Why can't glasses fix your vision? Few things are more frustrating than when you get a new pair of glasses and your vision is not any better. Or when you go see the eye doctor and you're not seeing well and they tell you that changing your glasses or getting new glasses is not going to help. In this video, we're going to talk about those situations when glasses simply can't help you see better. Why would that be? Aren't glasses supposed to help? Well, it helps to think about what glasses actually do. All a pair of glasses are, or contact lenses for that matter, are lenses that change the focus of light rays as they enter your eye. The whole point of getting glasses or contact lenses is so those lenses will focus the light properly as it enters your eye, so the image is nice and focused when it lands on your retina. So why is it that you can get glasses and still not see well? Well, there's two issues when it comes to your vision. There are two main things that help you see well. Number one, the light has to be focused properly. But number two is the eye has to function well. The eye has to be healthy so it can receive that light and process that light and resolute it to a sharp image and then send that information to the brain. Once the information gets to the brain, that's when you perceive what it is you're looking at. So for you to see well with glasses or to have 20/20 vision, really a whole host of things have to go right. From the light rays entering your eye, you have to have a healthy tear film. The cornea has to be nice and clear and not irregular and not opaque. The light has to go through the anterior chamber, through your pupil, through the lens, into the vitreous cavity, and then it has to land on the retina, on the macula. And then the macula has to process all that information and send the signal through the optic nerve to your brain, where it goes to part of the brain called the lateral geniculate nucleus, and then goes to the occipital lobe, where your visual cortex is, where that information is then processed and you're able to perceive what it is you're looking at. Any issue along that pathway can cause a degradation in the quality of your vision. It really is a miracle that any of us see at all. The only thing that glasses fix in that entire system of you being able to see is how the light is focused as it comes into your eye. So yes, glasses can fix any kind of focusing problem, but they can't fix a medical issue or an opacity in the eye or something that's physically blocking the light from getting to the retina, or some sort of impairment in the macula or the retina or the optic nerve or the brain. So it is important to distinguish these two aspects of the quality of your vision. Number one, how the light is focused. And number two, how healthy the eye is and the entire optical system is all the way back to the brain. As an ophthalmologist, I have patients who come to see me and talk about another eye doctor, and they will say they prescribe me glasses, but the glasses don't work. Well, obviously there can be a mistake in terms of getting the right glasses prescription, or the glasses may have been made incorrectly. But oftentimes that's just not the case. Oftentimes there's some sort of other pathology which is preventing the patient from seeing well. The most common that I see in the age bracket of patients that I take care of are cataracts. The lens inside the eye is cloudy, and no matter how well we focus the light in front of the lens, it still has to go through that cloudy lens. That cloudy lens, that cataract is going to scatter the light. The patient's not going to see well. Another very common thing that I see is glaucoma, a disease of the optic nerve, a progressive optic neuropathy. The light can be perfectly focused onto the macula. The macula can process all that information, but it simply can't make it to the brain because the optic nerve, the bridge that connects the eye to the brain, doesn't work. And so although light is focused on the macula, next to the macula, it just never makes it to the brain. Or a patient may have had a stroke. They may have had a stroke in the visual cortex in that part of the brain. The whole eye may work perfectly, and the whole visual system may work perfectly, and the light may be focused perfectly by a pair of glasses. But once it gets to the brain, they can't perceive what they're looking at because they've had a stroke. Another very common reason why people may not see 20/20 even with glasses is macular degeneration. The light rays come in, they're focused by their glasses, they're focused through their lens, and they land perfectly on the macula. But the macula is disrupted. It's not healthy. Those patients are not going to see well. They're not going to see 20/20 if they have enough macular disease. What I'm saying is there are plenty of reasons why glasses can't fix your vision. And I really wish I could fix all my patients' problems just by prescribing new glasses or focusing the light better. But unfortunately, that for many people, that just simply isn't the case. We either have to address the cataracts, manage the glaucoma, manage the macular degeneration, or address whatever other issue is causing you not to see well. which is not related to how well the glasses focus the light onto your retina. I hope that this has been informative for you. It's a very common point of confusion when people think that glasses should be able to fix their vision, when in actuality, glasses only fix one aspect of how well you see. See you in the next video.